Welcome to Legacy Magazine Presents Black Health, a weekly talk show discussing medical issues afflicting and impacting the Black community. Now introducing our host, Dr. Michelle Kirwan Blythewood.
Good afternoon and welcome to Black Health. I am Dr. Michelle Kirwan and I'm the host of Black Health. I am also a board certified pediatrician and the chief medical officer of a federally qualified health center in Miami Gardens called the Pediatric and Family Health and Wellness Center. And I am pleased to have with us today Dr. Anthony Amofah.
Hello, good afternoon. Thank you.
Hi, Dr. Amofah. Thank you for joining us today. It's a pleasure to have you.
The pleasure's mine.
I'm going to take a quick moment to introduce you. Dr. St. Anthony Amofah is the Chief Medical Officer at the Community Health of South Florida, which is also known as CHI, and he is the Chief Academic Officer for the Broads H. Hartley Junior Teaching Health Center at CHI as well. Dr. Amofah is a board-certified internal medicine physician, a fellow of the American College of Physicians, and is certified in risk management, managed care, and healthcare quality and management. He obtained his MBA with specialization in health services administration from the University of Miami and earned his medical degree from the University of Ghana Medical School. I also would like to point out from his resume that when the White House wants guidance on how to address disparities in the healthcare of underserved minority populations, it turns to Dr. Amofah. He has gone to Washington, D.C. multiple times to serve as a subject expert in healthcare. So Dr. Amofah, I've known you for quite a while, and I did not know that about you. I learned something new today.
Thank you.
So we'll go ahead and get started. Tell us a little bit about CHI.
Okay, well, thank you so much for this invitation. CHI is a topic that I could spend all day on, but I'll keep it short. So that's the Community Health of South Florida. It is a federally qualified health center. We've been around since 1971. And it started as a small clinic, 2 double-wide trailers by a community activist called Doris Eisen, primarily because at that time, community residents had difficulty getting to Jackson Memorial coming from the south. So this has evolved over the years under the leadership of Colonel Broads Hartley and now Mr. Blake Hall to a multi-specialty, multi-site organization with about 36 school-based clinics, 16 health centers. We're about 52 sites right now. We take care of over 70,000 patients a year with almost 350,000 patient visits. We're very proud of the fact that we have over 700 staff, very diverse. And I have to put in a plug into the fact that we have the first of the teaching health center programs that run residency training in Florida. We graduate about 6 to 8 residents every year. So that's what CHI is about. Multi-service, specialty organization, takes care of everyone regardless of ability to pay.
Yes, and like Pediatric and Family Health and Wellness Center, you all are also a federally qualified health center. So we have that in common, and I know you all do really great work in the south portion of Miami is where you're located, right?
We do our best. Thank you.
Yes. So let's go ahead and get started. We're going to talk about a little bit about coronavirus today and also touch on monkeypox. So we'll start with coronavirus. Why do you think there's an upswing or an uptick in the virus at this point?
Yeah, so that's been quite painful to see. In Florida, testing is showing, anywhere from about 15 to 20 out of every 100 tests being coronavirus positive. That's quite a lot. At one point, we're less than like 5 in 100. And we think it's because of several different reasons. A big one is the fact that the new coronavirus variant, the type of the virus circulating, is really highly infectious. And so it's more easily transmitted between folks, primarily through respiratory droplets, through coughing, sneezing, talking close to someone. So that has been a big one. Thankfully, it's been, it causes less intense disease, but that ability to infect is a big one. Another one we think certainly is that perhaps we've been relaxing in the extent to which we are masking and distancing a little too much, a little too quickly. And while we all want to do that, perhaps we are not paying enough attention in those high risk circumstances where we know that could even present bigger risk. Being in an enclosed room, in close proximity to other people rather than in open air and those kinds of things. Another one that's being suggested now is that perhaps there's a waxing of immunity that we've gotten from COVID, right? Many people got the initial COVID shots, but not getting the boosters that we should. And less increase in number of people maintaining their COVID vaccination status and hence the immunity. So those are some of the things that we think might be a reason for that uptick.
Yeah, I actually recently traveled and coming back yesterday, and I noticed that the majority of the planes were not wearing masks, and I was
Exactly
surprised given the increase in this variant and the transmissibility of this variant. It just surprises me. And young people, elderly people, I traveled with my family, and I was like, Mom and Dad, put your mask on now. I did not play. So I'm hoping we escaped without getting COVID, but there is a lot of COVID around right now.
And I think I'm equally worried about people who are coughing and sneezing with sniffles, who should probably be masking to protect everybody else around them, who aren't doing that. And interestingly, people who might be COVID positive, but choosing not to say anything, because of sometimes the expectations of them for quarantining, staying away from work, and all those things just keep adding up.
I think we've really relaxed our standards on COVID. So how does the community protect themselves from contracting COVID, even if they are vaccinated?
So I think several things have to happen. I mean, we said we want to move over vaccination quickly yet. We have to keep pushing the boosters, right? We know that as variants switch, the need for the different switches to the vaccines or vaccines to kind of boost immunity become important. But I think that very importantly, we have to be mindful of the high risk circumstances or situations, right? Because I think everybody wants to live. People want to be able to have time with family and friends and move on with life. But there's still high risk circumstances where we have to be careful, right? Large gatherings in enclosed spaces, I think is a big one. And without masking and handshaking and hugging and kissing. And certainly even in office space where people are in small offices, no longer masking. I think as a whole, we just have to be mindful of the extent to which we let our guards down, especially in high-risk circumstances. And maybe that's one thing we can do beyond just continue to push on the vaccines. I think pushing vaccines in kids is another way to go because they will easily transmit among themselves and bring it back home to elderly patients. So I think that's another area that we want to perhaps focus on. I think social distancing is something that we kind of losing the battle on. But we also do know that the impact of masks and hand disinfection or hand washing are even more impactful. And so we'd say that as a community, let's remember masking close proximity to other people, wash your hands, disinfect frequently. I think that probably will give us the best bang for the buck.
I'm going to piggyback on that question. So what do you say to people who say, but you can still get coronavirus even if you get the vaccine? So I don't know about this vaccine, or I don't know about getting another booster, and these boosters could go on and on and on. And what do you say to people? Because, a lot of folks say to me, well, I can still get it, so why bother continuing with the vaccination?
It's a very good question. We get that a lot from our patients and from families and friends. And I'd say the following. Number one, we have to recognize that we can always get COVID again and again. And you never know, the specific variant you're going to get and how your body's going to respond to it. So it's a risk you take, right? And we know that even though this doesn't happen often, there are people who get COVID, even though they're vaccinated, who get very sick. But the bigger one is the fact that you can still transmit the virus. Even though less, perhaps you might transmit the virus to a family member who's not vaccinated, who has a weak immune system. And that's really not fair, right? And so that's what I'd say. Also, we know that COVID has long-haul effects, right? So why get that, when we know the vaccines don't have those long-haul effects? And that's being more and more and very well described now. So I think for those reasons, the long-term effects of COVID, the fact that you cannot predict the extent to which you might react to it this time around, and ability to transmit that to family and friends who may not have a good immune system would be some of the reasons why you still want to get vaccinated.
Yeah, my brother had COVID in 2020. I think he just had a mild fever that lasted like nothing, some chills, and that was it. And then the next day he lost his taste and smell, and he lost it for 2 years.
Wow.
2 years he was out without taste. And the smell came back a little bit prior to the 2 year, but for 2 years. And it was very difficult for him.
That is a story very much worth sharing over and over again. And thank you for sharing that.
Yes, absolutely. So we are going to switch gears now and talk about the monkeypox. Tell us, what is the monkeypox virus? What is it about?
Okay. So, these viruses are very, very tiny organisms, right? Like super, super, super tiny. The viruses are. But the monkeypox virus is a virus that's very similar to smallpox virus that many people may be aware of. Virus that was discovered in the 50s in some monkeys and caused the first human disease in the 70s. So it's the virus that caused the disease we now call monkeypox. Even though it was found in monkeys, we still don't know the original source of that. Maybe rodents, maybe squirrels, and that kind of stuff. Mm-hmm. So there's this tiny particle, a tiny organism that can cause this disease we call monkeypox. That can be quite profound in its presentation, very similar, but less deadly compared to smallpox.
So how does somebody come in contact? How does one come in contact with monkeypox virus?
Okay. So there's several ways in which we can acquire monkeypox, and it's very important that we're very much aware of that. The most common one is a direct contact with someone with monkeypox or monkeypox rash. Right? That skin-to-skin contact over a prolonged period of time would dramatically increase the chances that you'd acquire this particular virus. And so that contact, either through hugging and kissing, even in sex, oral, vaginal, even anal, or touching bedding, clothing of someone with monkeypox, who would be shedding the virus into the clothing and the bedding, is another way in which you can get monkeypox. So you want to stay away from that when you know someone has monkeypox. We also do know that we can get monkeypox perhaps through respiratory droplets. It's still being researched. Probably not very, very likely, but I saw that it's possible with prolonged face-to-face contact. You can, but it's not very well described at this time. Another one I think I should mention is, unfortunately, you can get monkeypox. You can transmit it from the mother to the baby through the placenta. Mm-hmm. This is kind of painful, but it can pull that, but that's another way.
Wow. What are the symptoms of the monkeypox virus?
So I think that most people are aware of the rash, right? And then secondly, the flu-like symptoms. The rash will typically start anywhere in the body, anywhere. It could be just a couple of pimples in the genital area or anywhere on the hand or trunk, face. It evolves into bigger bumps and eventually blisters and becomes a scab and then it heals. So we encourage everyone to look at pictures of it, because the pictures are over on the internet and will give us a good sense of the kinds of rashes we should be worried about. But then you can also begin with like flu-like symptoms, like the headache, the chills, the body aches, the sore throat, the nasal congestion, and then evolve into a rash. Or you may not have that before the rash. And sometimes you might have these symptoms after the rash has come through. And those are two ways in which we're very familiar with how monkeypox presents. But not uncommonly in some people, maybe like 3 out of 100, the patient presents with very, very severe disease, very septic, sick, and fever, and that can be quite deadly, requiring even ICU type care.
So I imagine for people listening and hearing, the flu-like symptoms. So we get flu-like symptoms with the flu, we get flu-like symptoms with COVID. Now we get flu-like symptoms with monkeypox. And I'm imagining people now getting flu-like symptoms are going to be saying, oh my gosh, do I have monkeypox? So should they be looking for the rash to distinguish that this is monkeypox versus, and do you always get the rash with monkeypox?
Right. So I think the first thing is always to ask yourself, have you been exposed to someone who has monkeypox or who has a risk for monkeypox, right? Have you traveled to an area that has a high level of monkeypox cases? So it begins with thinking that way. If you don't have that, right, the likelihood that these flu-like symptoms are going to then lead on to or become monkeypox, that chance is very low. However, anytime we have these flu-like symptoms, we want to remind ourselves of the fact that it could be so many different illnesses or viruses. It's a good idea to be sensitive to those around us, right? Monkeypox invariably will lead to a rash. And so if you have flu-like symptoms, you're going to end up having that rash. The problem sometimes is that the rash might be a couple of bumps hidden somewhere in your genitals, for example, and you have no idea. So I'd say that if you have flu-like symptoms, you think that you may have put yourself in a position of high risk, like, been to maybe a party where people were not very fully clothed, skin contact, that kind of stuff. Begin to be mindful of your body, and if something else shows up, that might then be suspicious for that, and then you react to it very fast. That's what I would suggest.
Okay. So how do we protect ourselves from monkeypox?
So essentially, you want to prevent that direct skin-to-skin contact with anybody who has any suspicious skin rash or any illness, really. That skin-to-skin contact is very significant. And so when you happen to know that, you want to be careful. I'd say that you also want to be mindful of the setting to put yourself in, right? Going to a concert outdoor space where people are fully clothed, without people rubbing against each other a lot, that's safe. But to go to some club, most people naked, rubbing against each other, having different sexual activities in different pockets of that space presents significant risk. So I'd say, you stay away from that, or be mindful of those scenarios where you might cover your skin some more, right? If you cannot avoid those kinds of spaces. Certainly, the masking helps because it helps with other things. But safe sex, right? Even with that, we know that, using condoms and all that, while it can help, skin-to-skin contact with someone who has a rash can also transmit the virus. So I think it's about not putting yourself in those high-risk situations, being mindful of to not rub your skin against others who may be high risk or have a rash that is not been diagnosed yet, and certainly be mindful of social distancing appropriately because life still has to go on.
So if you feel that you've come in contact with somebody who has monkeypox or may have monkeypox, what should somebody do at that point?
Very good. So you said you want to contact.
Sorry, and what can be done at that point?
Right, sure. So first of all, you say you want to, contact your primary care physician. You can do that through the phone. That's a good idea. Because most people are going to have what's called a self-limited illness, right? You might not be too sick to have anything else done. But then that physician or provider is going to make a determination, right? Should this person have treatment for monkeypox? And then guide you on how to protect others around you. Others who may come into contact with you may be high risk enough to need a monkeypox vaccine that's available in Florida significantly. And many of our health centers, including mine, we have them available for you. And so it's about, do you meet criteria for treatment? And treatments do exist. And do the people you come in contact with meet criteria for the vaccine? Because that also is available. But part of that would be making the diagnosis. So we might, take some cultures, specimen. We might draw some blood. If you happen to go to the doctor's office, for those who might do that because maybe they don't have access to having a video call, something like that, you want to make sure you're fully clothed and you have a mask on, right? Because you're going to put other people at risk. We really don't want to do that, but we know that can happen sometimes. And so if that has to happen, fully for clothing, masking, distancing from other people, quickly announcing your illness to someone would be the way to go.
And preventing the spread by making sure you remain apart from others until you're diagnosed and treated. So you mentioned criteria for treatment and criteria for vaccination. Can you tell us a little bit about what those criteria are?
Sure. It's just one breath, immunocompromised, right? And so the several conditions that put you at significant risk for bad outcomes. And so we would go through the checklist of some of these immunocompromising conditions, HIV, AIDS, for example, low white cell count conditions, having certain cancers, for example, having certain chronic diseases, rheumatoid, lupus, patients on chemotherapy, for example. And those patients are at high risk for developing more severe disease. And so either for the vaccine or for treatment, these are the kinds of conditions that we would consider to determine if you're eligible. In large part because the vaccines are not super abundant, right? The vaccines do have some risk, and so we always have to weigh the benefits and risks. And we know that the benefit of the vaccine is more significant in patients who are at risk for severe disease. The benefits outweigh the risk of that outcome from monkeypox. And
you said the vaccine is available at CHI?
That's correct. And there's several health centers in Florida as well where we have the vaccines. The departments of health do have the vaccines. CHI certainly does have a good supply of vaccines. So we welcome to take advantage.
That's great. Why don't we take a moment then to tell the audience, can you give an address or phone number or website where they can contact CHI if they should need to be screened for monkeypox and not just coming for the vaccine, right? They first need to be diagnosed. I know sometimes we say these things and then you get a bunch of calls. I need the vaccine. I need the vaccine. So I know there's some, as you mentioned, there are criteria for the vaccine. So should they meet the criteria for the vaccine and to get it at CHI, what information or what phone number or website would they be looking to contact?
Most definitely. So if you call 305-253-5100, you let the staff know when they pick up what your concern is, and we redirect it to the right person or people to address that. The website also being run under the screen there is www.chisouthfl.org. Certainly through that, you'll be able to send us a message as well, and we make every attempt to respond very quickly.
Excellent. Thank you, Dr. Amofah. So has monkeypox reached epidemic proportion in the country, in the United States or in the world?
So at this point, it's not been defined as a pandemic or epidemic yet. It's been described as a multi-country outbreak, right? The same criteria that have to be met to call that a pandemic. For example, in a real pandemic, the numbers are significant enough to affect life and lifestyle. Monkeypox hasn't gotten to that level yet, but the numbers are pretty significant. Between 2 or 3 months ago and now, the numbers are continuing to go up, so they present concern. While we wouldn't call it a pandemic or an epidemic, the World Health Organization in the US, we talk about this being a major outbreak and a public health emergency because of the potential to get out of hand.
So there's a saying, when America gets a cold, the Black community gets the flu or pneumonia or one of the others. How is monkeypox affecting the Black population? Is it, we seem to be more affected by many diseases and illnesses and so on. Is that the case with monkeypox?
Unfortunately, yes. While Blacks and Hispanics, while we make up just about a third of the population, we have more than half of monkeypox, and so it is certainly significantly more affecting us some more.
Wow. Okay. So with 2 deadly viruses on the world stage, or potentially deadly or potentially significant morbidity. With these viruses on the world stage, what can we do to protect ourselves?
I think in general, let's remind ourselves we're not out of the woods yet, right? We want to live, we want life to happen, but we must not let our guards down completely. If you're going to be, I'd say, on an airplane, we're in a closed space, even though our airlines do a great job in filtering out the air, can you wear a mask to limit your risk? If you're going to be in a small space in an office with other people, can you put on a mask and some distance to minimize your risk? Must you be in a circumstance where you're going to be rubbing against each other? Could you be fully closed as your path to minimizing your risk? Can we be mindful of those types of prolonged contacts that can then lead to us transmitting infection? certainly, oral, genital, anal sex, where that can happen. And can we make sure that in those circumstances, we're looking at the risks of the chances of the people who we're exposed to may have monkeypox, and hence kind of stay away from that. So there's so many different things that we want to be doing. But I think if we want to walk away from this is one thing, it's we're not out of woods yet. Let's not let our guard down completely. And maybe to remember that it's always safe to make the assumption that the person next to you could have monkeypox or COVID. And if you have that in mind, you're just a little bit extra careful. Again, life does happen. People want to move on with their lives. But can you be a little more careful? Maybe that might be what might save our lives.
Yeah, that's excellent advice. Have you seen monkeypox at CHI? Have you had any cases?
We've had 2 patients who came through that ended up having monkeypox, caught very early with almost minimal contact with other patients. That was great.
Great.
Our clinicians were very good in identifying these rashes that were actually not visible, and that kind of pointed us in that direction, and then they were diagnosed subsequently.
Excellent. I know that there has been some talk about physicians being afraid of treating patients with monkeypox, or being around patients with monkeypox. So it's great to hear that your physicians were on it and not backing down from it, and to diagnose it, and were the patients treated successfully?
Yes, they were. They were. They did very well. So that was great.
Excellent. So that we're coming to the end of our show, Dr. Amofah. Do you have anything else that you would like to say about either coronavirus or monkeypox, or perhaps CHI? And definitely give us the information about CHI one more time after your closing remarks.
Sure. First of all, thank you so much for inviting me out here to chat on this topic. It's always a pleasure to talk to you, Dr. Kirwan. You're someone that I've always had a lot of respect for. Someone who's always giving us a lot of guidance in CHI. I would say that, COVID, monkeypox, they differentially affect us more as Blacks, and we have to recognize that. It's not because we've done anything wrong. It's the mathematics and the mechanics of it. So as a result of which, we just have to be extra careful, I would say. And that's why I don't want to walk away with. CHI will always be there for everyone, insured, uninsured. We're very proud of what we do. We have great leadership. We have a new CEO who really has a big heart for patients. Mr. Blake Hall, a leadership team, and providers who really care, who are not afraid of monkeypox. So you can reach out to us, 305-253-5100. We can guide you if you need some questions answered, if you're worried that you may have that. And we certainly will make sure we send you in the right direction.
And Dr. Amofah, you all are at a federal qualified health center like we are, so you have a sliding scale for uninsured patients, correct?
That's correct. That means then that based on your income, we do an assessment of how much you pay for the visit, and if your income is such that you qualify for complete discount, you get that as well. We don't turn patients away. We might work out payment arrangement, but we make every effort to take care of everyone. That's where we are, the safety net. Just make sure that everybody has somewhere to go. That's what we do.
Excellent. Well, thank you, Dr. Amofah, for being our guest today. Thank you for the very valuable information that you've given to our audience listening today. It's always a pleasure to speak with you. Always a pleasure to hear about CHI and all the amazing work that you all have been doing and continue to do. Congratulations on all of that in your residency program and all of the great work that I know you personally have put in at CHI. When I started at CFCE, or the Pediatric and Family Health and Wellness Center, almost 10 years ago, if you can believe it now, Dr. Amofah, you were the one that helped me get my start as the Chief Medical Officer there. So I have to personally thank you as well for that. And now, before we close, I would like to take a moment to thank our sponsors. Black Health is brought to you by Family Medical Marijuana Education and Research Institute. Get credible information and engage in a safe space to learn about and talk about cannabis. Educate, learn, and talk about cannabis in Florida. FAMU Medical Marijuana Education and Research Institute. Thank you once again, Dr. Amofah. Always a pleasure to speak with you. Thank you for your wonderful words and your advice today for our audience. And we do hope to have you again in the future as a guest on Black Health. Thank you to all of you that are listening and tuning in with us today. Have a great day, everybody.
Thank you.